I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and today let's talk a little bit about lymphovascular invasion as it relates to breast cancer. Lymphovascular invasion are words that you might see either on your initial biopsy pathology results or after surgery. Lymphovascular invasion means exactly what this diagram is depicting, that the cancer cells are either invading into the wall of a blood vessel or into the wall of a lymphatic vessel. What that tells us is a breast cancer with lymphovascular invasion has cancer cells that are already more likely to spread than a breast cancer that doesn't have any signs of lymphovascular invasion on the pathology report. This was a study which was presented at the American Society of Clinical Oncology this year in 2025, which looked at what is the difference between cancers that have lymphovascular invasion and cancers that don't in terms of their likelihood of spreading to other places in the body. The study showed that lymphovascular invasion is an independent risk factor for cancer coming back, and for those patients whose lymphovascular invasion was only seen in the breast and they did not have any evidence of cancer in their sentinel lymph nodes, having lymphovascular invasion in the breast meant that their likelihood of the cancer coming back was similar to someone who had one or two positive lymph nodes. The study also showed that giving chemotherapy didn't make up for the fact that lymphovascular invasion means that the cancer is a little bit more likely to come back. So what this means for patients is that when we know that they have LVI, we as members of their oncology team need to watch them a little bit more closely because the cancer may be more likely to come back. Now, this does not mean that every patient with LVI is going to see their cancer come back. The vast majority of patients who have LVI don't see their cancer come back because the things that still determine whether or not cancer comes back are the type of cancer it is, if it's spread to the lymph nodes, how many lymph nodes it's spread to, and the grade.